Healthcare reform, mandate, Obamacare, pre-existing conditions.
You've probably heard these words a lot over the past year. The new healthcare law can be confusing and overwhelming for anyone.
Maybe you've never had health insurance, or maybe you've recently lost your health insurance, or maybe you have a health insurance that doesn't seem to work for you when you need it to.
Perhaps you've tried to buy health insurance in the past, but it was too expensive, or you kept getting denied. Perhaps buying health insurance sounds like a waste of money to you, but you've been hearing that the new healthcare law will require everyone to buy health insurance.
In the next 6 minutes, we're going to give you the basics about what you need to know about the new health insurance marketplace in Georgia and how it can help you and your family.
If you have been uninsured for a long time or recently lost your health insurance, you are not alone. In the U.S., people typically have insurance either through their job or through a government program like Medicare or Medicaid. Unfortunately, 50 million people in the U.S. do not have any health insurance at all.
Having health insurance matters. Each year, nearly 45,000 deaths occur in the U.S. due to lack of health insurance. That's because having health insurance allows people to get the help when they need it, rather than waiting till their health conditions get worse.
Health insurance allows you to see specialists and afford medications. Having health insurance is also important financial protection for you and your family. A broken bone or a same-day surgery can be very expensive. Medical problems like injuries from a car accident or cancer can put a family into bankruptcy.
So health insurance is important. The good news is that through the new health insurance marketplace, there are new options for you and your family.
So what is the health insurance marketplace? With the passage of the Patient Protection and Affordable Care Act, each state has a health insurance marketplace where individuals and families can purchase private health insurance.
Doesn't matter where you work, how much you work, or if you have health problems. Anyone can view his or her health options through the health insurance marketplace.
All plans in the marketplace must cover the essential health benefits. These include well visits and annual checkups, sick visits, hospitalizations, prescription medications, mental health services, maternity care, and pediatric care. Regardless of which plan you choose, all plans must cover these benefits.
That may sound great, but your next question is probably how much will health insurance like this cost me? The price is different based on family income and family size. Once you fill out an application, you'll be able to see what each will cost for you.
If you make less than 400% of the federal poverty limit, you will qualify for a subsidy. This is money from the government in the form of a tax credit that can be applied towards the purchase of health insurance. If you make less than 250% of the federal poverty limit, you will also qualify for a discount.
Next, you get to decide whether you want a bronze, silver, gold, or platinum plan depending on how much you want to pay each month and how much you like to pay when you go to get your health care.
Platinum plans have the highest premium, which is the amount of money you pay each month to have health insurance. But platinum plans cover 90% of all your medical costs. This means that when you go to your healthcare provider or hospital, you won't have to pay very much. Bronze plans cost the least amount of money per month, but they only cover 60% of your medical expenses. This means that you will have more out-of-pocket costs when you go to your healthcare provider.
Maybe you have insurance and you're wondering, how will this healthcare reform affect me? If you have insurance through work, Medicaid, or Medicare, you can keep your insurance. You do not need to enroll in the health marketplace.
If you have health insurance now, you can still see your options in the marketplace. You may be able to qualify for more affordable health care, and you may qualify for a subsidy or discount if your current health insurance plan costs more than 9.5% of your annual family income, or if your current health insurance covers less than 60% of covered medical expenses.
It is important to remember that the new healthcare law does include a mandate, which is a legal requirement that all U.S. citizens and legal residents must purchase healthcare. This means that if you do not purchase healthcare through your work or through a government program like Medicaid, you're required to purchase it through the marketplace. If you do not do so, you can face a tax penalty.
There are exemptions to the mandate. If you and your family fall below the threshold to file federal income taxes, which is approximately $10,000 annually for an individual and $20,000 annually for a family, you are exempt from the mandate. Also, if purchasing health insurance would cost more than 8% of your annual income, even once subsidies and discounts have been applied, you are also exempt.
So let's talk about enrolling in a health insurance plan for you. You can go online and fill out an application at www.healthcare.gov or on phone by speaking to a live representative by dialing 1-800-318-2596. So remember, you can apply online or by the phone to hear which options will work best for you without signing up. Then you'll be able to decide.
You may have more questions about your options or prefer not to enroll by the internet or by phone. Here's some good news. You can walk through the entire process with a health insurance navigator. Navigators are people who have received special training to answer your questions about the health insurance marketplace and help you enroll. Navigators are paid for by the government, so they do not work for the insurance companies. Their only job is to help you, and you do not have to pay a navigator at any time. To find a navigator in your area, call 855-899-6092.
Healthcare reform and the new insurance marketplace can be confusing, but navigators are ready to help. Take time today to check out your options for health insurance.
Having health insurance protects your health and your finances. Even if you've never had health insurance before, you have new options now.
So take a step today to protect the health of you and your family by checking out Georgia's health insurance marketplace.